Namaskaram. This is Dr. Pooja, Consultant, Department of Ayurveda from Sleeva Medicity Palai. We at the Department of Ayurveda are happy to introduce a new treatment therapy for focusing on women's health. So this therapy will help to revive a woman's health in a comprehensive manner. So we are intending to cause a 7-level health revival. So basically, we are reviving the reproductive functioning of the female of specific age group. This we will be implementing through administering Ayurvedic detoxification procedures called Panchakarma therapies, and also the important part of this whole therapy program is to follow an Ayurvedic lifestyle regimen. So this lifestyle regimen is an age-old regimen, and which is holistic in nature, and which will allow the women the functioning of the human body to align and be in harmony with the laws of nature, and it is totally an Ayurvedic way of living. So this revival therapy is beneficial for women who are having menstruation complaints. It may be painful menstruation, or it may be a irregular menstruation, or it may be a lengthy menstrual cycle, or it may be like increased bleeding or decreased bleeding. And women who are also having hormonal complaints like PCOS or polycystic ovarian syndrome or premenstrual syndrome, they can also benefit from this revival therapy. And we are also catering to women who are in their menopausal phase, like right before the menopause. It's called perimenopausal period. So that phase, any issues that the female is overcoming, that can also be managed very well with this revival therapy. So let me take you into what this revival therapy is all about. PUNARNAVA. PUNARNAVA itself means to revive you. And we are intending a 7-level health revival. So basically, we are trying to appropriate the female reproductive system. This in turn will enable the women to have a sound menstrual health, a sound endocrinal health, a sound reproductive health, and a sound menopausal health based on the age group of the women. And once we establish this reproductive health, in turn the women will also be bestowed with an overall physical health, mental health, and social health. Sexual reproduction is not the only outcome of a female reproductive system. The proper functioning of this reproductive system will contribute in the well-being of a woman's health during her menstruating phase, during her non-menstruating phase, and this reproductive functioning will also contribute in the well-being during her period of pregnancy, during the period of delivery, during the period of postnatal phase, and also during the period of perimenopause and menopausal phases. Now we'll know what is the factor that actually determines this reproductive health in women. So it is naturally the female sex hormones. So we know that the hormones in every major event of a woman's life, be it puberty or be it pregnancy or delivery or menopause, all these events are driven by the play of these hormones. And speaking of menstruating women, every month these hormones are actually fluctuating constantly in line with the women's menstrual cycle. So this fluctuation is impacting the health of the women on a day-to-day basis. For the same reason, because of this constant fluctuation in the hormones, it is important that we strike a relative balance between the production and utilization of these hormones. So one sign of good health, good reproductive health, is a regular menstrual cycle. In order to cater to different specific women of specific age groups, this revival therapy is sectioned as Rajomati Rutumati, where we will be catering to women of age group between 12 and 45, and here we are intending to revive the menstrual and endocrinal health. The second section is the women of the reproductive phase, and hence the age group between 21 and 35 years. So here we'll be catering to the reviving of the reproductive health in order to conceive a healthy progeny. And the third section will include women who are above 50 years or above 45 years, so that they here will be catering to revival of their health with regard to the menopausal phase. So any perimenopausal issues or irritation or agitation or hot flushes, all these we will be tending to, and also will also include the menopausal women. Any issues post menopause also will be catered to. Self-care is self-preservation, and self-care is a discipline. Indulge in a new treatment revival therapy, PUNARNAVA. Revive yourself and revive the community as well. Turn yourself not older in years but newer every day. Thank you.